Good afternoon, everybody. I'm pleased to be here today at Cook County Health. Joining me are our U.S. Senator, Dick Durbin, U.S. Congressman Bobby Rush, U.S. Congressman Sean Casten. We hope to be joined shortly by Congressman Danny Davis, Cook County Commissioner Dennis Deere, Claudia Fegan, our Chief Medical Officer, and Jimmy and Patricia Moore, who are patients at Cook County Health. I'd like to thank Donna Stanton and Michael Albert, who are our sign language interpreters. And before we begin, I am requested to take a roll call of who's with us on the phone. Nick?
Yep. Wendell Hudson, Crane, Chicago Business.
Becky Vivi, WBEZ. Lisa Shanker, Chicago Tribune.
Okay, ready to go? I forgot one acknowledgement, Katanya Norwood, who's Senior Director of Pharmacy Services at Cook County Health. My apologies, Katanya. We're here today to discuss a critical issue that directly impacts the health, wellness, and safety of our patients at Cook County Health and all of the residents of Cook County. The U.S. Postal Service has made cost-cutting measures, such as slashing overtime and curbing late delivery, which has created significant delays in mail deliveries across the country. And while recently Postmaster General DeJoy declared an official suspension of some of these operational changes that he'd planned to institute this year, the Trump administration has remained firm in its dedication to block the resources necessary to provide this essential service, mail delivery. This has severely impacted seniors and other individuals who are at high risk of exposure to COVID-19 and who depend on the U.S. Postal Service to deliver their mail order prescriptions on time. Many patients at Cook County Health choose mail order prescriptions for the convenience it provides. There's no need to worry about transportation, getting to the pharmacy, or concerns over the risk of exposure to COVID-19 in order to get their daily medications. Patients have been able to depend on the U.S. Postal Service to deliver necessary medications on time to their front door. However, as the U.S. Postal Service delays mount, more and more patients at Cook County Health are seeing longer wait times to receive critical medications, and our doctors, pharmacists, nurses, and staff are concerned because the problem is growing. Thankfully, we're blessed with courageous leadership in Washington from Cook County. The representatives here today understand the issue and are taking action. Senator Durbin has sounded the alarm in this regard and will discuss how the U.S. Postal Service changes and service reductions have impacted the health and safety of our Illinois residents and Americans across the country who rely on mail order prescriptions and other deliveries. Congressman Rush will also address the needs and concerns and challenges that service cuts have on at-risk communities in his district. Congressman Davis has had staff working actively to address complaints in his district. Congressman Davis has always had a close relationship with the U.S. Postal Service. He was once an employee there. Congressman Sean Casten tells me that he's gotten over 2,000 calls to his district on this subject, and he'll address the specifics of the legislation recently passed in the House to support the Postal Service. And our own Commissioner Dennis Deere will talk about the impact on communities of color. He's head of our Health Committee, the Cook County Board of Commissioners. Just this past weekend, the House passed a $25 billion aid package for the Postal Service that will now head to the Senate. We appreciate their efforts. Lastly, I'm grateful to Mrs. Patricia Moore, who's here with us today. Ms. Moore is a patient at Cook County Health and who's personally experienced medication delays due to the Postal Service. She's a patient, actually, of Dr. Fegan, that's what I'm told. As you'll hear in Mrs. Moore's story, this isn't about politics or partisanship. This is about people and their lives. We're here because we're worried about the health and safety of the residents of Cook County. There are hundreds of thousands of seniors and patients with disabilities and complex conditions affected by the Trump administration's failure to do its duty. We're proud to stand with them as we stand up to protect this essential service. Now I'd like to invite Senator Durbin to the podium.
Thank you very much, President Preckwinkle. Thank you all for being here today, my colleagues, Dr. Fegan and Mrs. Moore in particular. Thank you so much for being with us today. Why did this postal issue become such a big national issue? Why won't it go away? Why do we keep talking about it? Because when it gets right down to it, the Postal Service is very personal to America, very personal. We also know that the Postal Service in this country has a 90% favorable rating. Can you imagine a government agency with a 90% favorable rating? We all dream of that as politicians. It's an indication, though, that the Postal Service, created by the Constitution, has become a critical part of our lives. Politicians look at this postal crisis and say it's a matter of life and death, political life or death. Will the ballots be delivered on time to be counted? But the rest of America looks at the Postal Service and said, it's literally a matter of life and death, Senator, because we're waiting for our medications to come in the mail. And if they don't arrive on time, it may not be good for our health or our future. And that's why we're here today, to translate this issue into one of relevance to millions of Americans. The Postal Service handles 1.2 billion prescription drug shipments every year, essential for seniors, parents with disabilities, veterans, and folks that live downstate in small towns. 90% of the seniors take a prescription drug, and 1 out of 6 of them rely on the mail for their medication. 80% of veterans get their VA prescriptions by the mail. And so we know that it's something that people count on and look forward to. With so many patients postponing health care appointments due to COVID-19, opting to get their prescriptions delivered by mail, and the timely delivery of that mail is critically and personally important. I've sent a letter to the major Illinois health organizations with Senator Duckworth, asking them to really help us measure the impact on medical care across our state. I want to thank President Preckwinkle for drawing us together to talk about the impact on Cook County health and on this region of the state in particular. One constituent from Chicago who contacted our office had not been receiving reliable mail deliveries for the past 2 months. She called us and said, I finally just had to go to the post office to start picking up my mail. When she arrived at the post office, she waited in line for 2 hours to pick up her mail. That kind of inconvenience is not even practical for many people. They don't have the mobility or the opportunity to pick up their own mail. She gets her diabetes medicine through the mail. She's worried if it's delayed what it could mean, and I think we all understand that. Her local mailman told her they were flooded with packages and they were not allowed to work overtime. They could only deliver what they could each and every day, and that's why we're here. It was less than 2 months ago when a new Postmaster General arrived on the scene. Mr. DeJoy, it turns out, was picked by the Trump administration to execute a reorganization plan at the post office. Yesterday's New York Times had a front page story about Secretary Mnuchin making sure the Postal Board of Governors picked the first Postmaster General with virtually no experience with the post office. He was supposed to turn the post office into a company, a corporate entity. May I remind all who are involved, it is the Postal Service. It is not the postal company. Of course we want it run efficiently, but we understand that the service aspect of the post office is what we as Americans value the most. When he starts cutting back on overtime, 20% of the work that's being done is going to be delayed. I asked at my local post office, what does it mean? Well, we take it from the main post office to the satellite post offices for delivery. We fill the truck, and if there's still some to be delivered, we hang on to it for a later day. Really? And what's included in the things you hang on to for a later day? Somebody's critical prescription that they're waiting for? That's why overtime and doing the job every day to deliver the mail on a timely basis is literally a matter of life and death. So I want to salute my colleagues from the House who are here, Bobby Rush and Sean Casten. I know that Danny Davis is on the way for what they did last Saturday. They came back to Washington. and they said, this is a national emergency. We need to put the money on the table, and we need to stop the current Postmaster General from in any way jeopardizing the delivery of the mail. And it isn't just about ballots. It's about prescription drugs and medical supplies that are literally a matter of life and death. Bobby Rush, I think you're the next one up.
I want to thank you, Senator Durbin. I certainly want to commend the Cook County Board President, President Preckwinkle, for her exemplary leadership, for her firmness in terms of addressing the needs of the constituents of Cook County. I want to thank Mrs. Moore for taking the time out to be here, my colleagues who are in Congress and others. I guess I'll say Lottie Dottie and everybody. I want to thank you all for being here. Many centuries ago, the Chinese conqueror, Genghis Khan, actually invented the concept of a postal service because he wanted to unite and coordinate his vast empire. And since that time, the idea of a postal service as being a single unified force that unite nations, particularly our nation here in the U.S., has not lost its power in all these years. Sadly to say that never before in the history of this nation or any nation recorded in history has there ever been an attempt by any national leader to eviscerate, destroy, or to eliminate in any way, diminish the need, the absolute need that citizens of their nation have for a robust postal service. Only Trump and the Trump administration can stand on the horizon and attempt to block the Postal Service from accomplishing what it is that they were originally set out to accomplish. Earlier this summer, I was shocked, absolutely astounded to hear reports of alarming and unprecedented letter and parcel delays that were occurring in my district. This is the reason why I was motivated to call a town hall meeting, e-town hall meeting in my district back in late July. And I was alarmed after hearing about 3,500 of my constituents participate in the town hall meeting, the e-town hall meeting, and hearing their stories of those who were on the meeting, on the call, 40% stated that they had not received mail for at least 1 week. 11% stated that they had not received mail for 2 weeks. And 9% claimed to have not received mail for 3 weeks or more. Following this e-town hall meeting, I immediately called on the U.S. Inspector General to formally investigate what I thought were really discrete issues. I looked at the local post office themselves, the employees, and I thought, well, maybe they were deficient. Maybe they were the problem what was going on with the management there. I had many conversations with the Chicago postmaster, pointing the finger at her, blame. Why don't you get your department, your office, why don't you get this Postal Service in order? Little did I know that it wasn't their fault, it wasn't ineptness on their part. This was a calculated scheme by the president and his buddy to sabotage this upcoming election. And that's the reason why I'm co-sponsored and voted in support of the Delivering for American Act, which, as Senator Durbin said, will provide $25 billion in necessary funding to support the Postal Service, and that requires the Postmaster General to reverse, not just stop, but stop and reverse. In other words, in the lexicon of the street, I have called on the U.S. Postmaster and the Trump administration to take a new form of stop and frisk in terms of the Postal Service. This is not just about the election. This is about countless elderly and vulnerable citizens all across the land, my district, Cook County, the state of Illinois, and across the entire country, who rely on U.S. Postal Service to deliver life-saving prescription drugs. 1 out of 5 of the people on my town hall conference call indicating that they relied on the mail to deliver their medication. We passed this legislation on Saturday. It's now headed to the Senate. And we ask, plead with, and demand that Mitch, the merciless, show some mercy to our seniors, our elderly, whose life depends on a robust Postal Service and to deliver their mail. If someone like as Genghis Khan could understand the importance of the Postal Service, why can't Mitch, the merciless, understand it also? Thank you.
Thank you, Congressman Rush. Thank you, President Preckwinkle, for hosting this event. And lest we forget, thank you to all of our postal workers. This is a problem with the director of the Postal Service. It is not a problem with our postal workers. And when you go out and you talk to these folks, it's heartbreaking. These are people who take pride in the fact that when they get home at the end of their shift, their truck is empty. And they haven't been able to do that. They haven't been able to get the overtime pay. And they're feeling discomfort when they're getting yelled at by their customers saying, why isn't the mail here? So I just ask everybody to have some respect for the folks who are working hard to deliver the mail and understand and save your hostility towards those who are blocking their ability to do the job they want to do. As President Preckwinkle mentioned, we've had over 2,000 calls to our office. These have been from small businesses wondering how it is that they are going to meet contractually mandated delivery deadlines when they're waiting for a part that isn't showing up. It's people asking why in this country that has this beautiful 244-year-old experiment in democracy that's the bastion of the rule of law around the world, why are we asking our citizens to choose between their health and their civic obligation to vote? And we're getting calls from seniors whether they're covered by the VA system or by private insurance or by Medicare or by Medicaid, saying, I'm not allowed to get more than 30 days of drugs at a time, and my mail hasn't shown up for 4 days. We are literally going to kill people for the benefit of some political stunt during an election year. It is unconscionable. The words that we need to use to describe that are not appropriate in a press conference. But the words you're thinking in your heads are the words you should be thinking right now. So what we did in going back was we basically did two things in the Delivering for America Act. The first is to acknowledge, as Congressman Rush said, that it is not enough to stop doing bad things. You have to undo the damage of the bad things you did. And when Postmaster DeJoy said that he would no longer block overtime, would no longer move machines down, he admitted that he was lying, because he told us before that he had to stop them because they didn't have the resources. So we said in this bill that you have to maintain delivery standards consistent with the standards that were in place in January 1 of 2020 this year. You have to make sure that all election postage is treated as first-class mail, as it always has been. And then on top of that, we then re-added a provision that was in the HEROES Act that we passed in the House 2 months ago. When the coronavirus hit, all of the Trump-appointed Board of Governors from the Postal Service asked Congress for additional funding to cover the specific costs of coronavirus. And again, this is about protecting our postal workers. The Postal Service all of a sudden had to be social distanced, as we are now in their sorting stations. They had to get more PPE. They had a huge shift, as so many of us started buying things through the mail that were bulkier than what we normally buy through the mail. And so the cars and the infrastructure to handle this weren't perfectly suited to the current load. They asked the Congress to provide them with $25 billion of additional funding. Again, these were all requests from Trump-appointed members of the Board of Governors. We approved that. We put it in the HEROES Act for reasons that remain mysterious to all of us. Mitch McConnell has decided to do nothing with that over the last 2 months. So we have carved that provision out and put it into this bill to make sure that the post office was what it needs, what it says it needs, receives what it says it needs. And we passed all that. I was delighted to see that it was overwhelmingly bipartisan, because the need for medication doesn't care what party you are. It doesn't matter whether you're in a rural or an urban or suburban area. It doesn't matter what the color of your skin is. The mail works for all of us. It's the same postage price for all of us. We got, I think, 25 Republicans that signed on. We have done our work in the House. If you can do anything to help, Senator, with Mr. McConnell, do the work, finish the job, and let's make sure that we restore the post office. Thank you. And it's now my pleasure to introduce Dr. Claudia. Oh, sorry, I'm out of order. It's my pleasure to introduce you.
Thank you. Good afternoon. Yeah, it is afternoon. Thank you so much, Madam President, for hosting this press conference on such a topic as it is today. At the end of the day, we're talking about the post office, but we're also talking about our democracy. We are talking about saving our democracy. And that's what we've been pushing. Just this past Saturday, I was in front of the post office right in the center of my district with other black and brown members of elected officials as well as community members. And we were protesting our democracy, protesting the fact that someone is trying to take our democracy away from us. I sit on the board also of this hospital. We are concerned about our patients not getting their drug orders in the mail. And guess what? Our senior citizens are some of our greatest citizens in this country, and they won't be getting their medications. It's a hot day outside. Guess what that means? People with asthma are suffering. I'm one of them. And guess where I get my prescriptions from? Through the mail. So I'd be impacted by this. And lastly, individuals in our communities, particular underserved communities, black and brown communities, they are always impacted 2 to 3 times more than any other community. So at the end of the day, this is about us saving our communities, saving our patients, saving our hospitals, and helping take America to the next level where she should be. God bless you all.
Good afternoon.
Good afternoon.
I'm Dr. Claudia Fegan. I'm the Chief Medical Officer for Cook County Health. As President Preckwinkle pointed out, Cook County Health patients have experienced major delays in mail deliveries for their needed daily prescriptions due to the U.S. Postal Service's cutbacks. Our patients, as doctors, nurses, pharmacists, and staff caring for our patients, we are worried about people being able to receive their medications on time without disruption. Our patients are seniors, they're veterans, they are people who have mobility and transportation issues and are at higher risk for COVID-19. Cook County Health mail order pharmacy fills more than 20,000 prescriptions on a monthly basis and uses the U.S. Postal Service to deliver those medications. Prior to March 2020, less than 1% of our Cook County mail order prescriptions were delayed. In June of 2020, the number climbed to 18%. It increased to 23% of prescriptions being delayed in July. We have some zip codes where 50% of our mail order prescriptions were delayed. Cook County Health patients have been able to rely on the pharmacy and the U.S. Postal Service for many years. This is yet another example of the impact that policy changes have on our vulnerable population. Our patients deserve high-quality care and continuity of care. They deserve to be able to receive their medications and not have to worry about how they will be able to get to the pharmacy during the pandemic to pick up their medications. I've had the privilege to care for Mrs. Moore for the past 15 years at our Woodlawn Health Center. Recently, Mrs. Moore reached out to me because she was frustrated and concerned because she was running low on her daily blood pressure medication, which had not come in the mail. My physician's assistant had to assist Ms. Moore by putting in an emergency prescription for her to go and pick up at Providence Hospital Pharmacy to fill the gap while she waited for her normal delivery of prescription medication. Mrs. Moore's condition is well managed because she takes her medicine regularly and she takes it on time. Stopping antihypertensive medications for high blood pressure will allow blood pressure to rise and put my patients at risk for stroke and the other complications of hypertension. High blood pressure is the most preventable cause of stroke, according to the American Heart Association and the American Stroke Association. Mrs. Moore's medications were one of many in the United States impacted by the U.S. Postal Service's delays. Mrs. Moore dealt with unnecessary concerns and frustrations, and she is one of many Cook County Health patients who have had the same issue. Our doctors, nurses, physician assistants, and pharmacy staff have had to help numerous patients, like Mrs. Moore, in dealing with the delay in their mail order medications. During the pandemic, it is critical that we keep our residents safe and at home, especially those most vulnerable, our at-risk patients. That is why we need our patients to be able to receive their mail order medications without delays and without worry. I'd like you to meet my patient, Mrs. Patricia Moore. Ms. Moore.
Good afternoon, everyone.
Good afternoon.
It's a pleasure to be here to speak out to Toni Preckwinkle, Dick Durbin, Bobby Rush, Sean Casten, Danny Davis and his and my doctor, Dr. Fegan. I had a big problem with my high blood pressure medicine about a week or two ago. I called Dr. Fegan because I was almost out of my medication. So I know that you have to, when you get my medication from Oak Forest. So I know that a certain amount of medication, when you get low, you need to call and put it in. So I did that, and I've been dealing with that with Oak Forest about 7, 8 years with the mail order. Never had a problem. But this particular time I called, and after about 7, 8 days, I didn't receive it. So I called Dr. Fegan and asked her would it be okay for me to just wait and don't even try to get it? She said, no, you have to take that medication. So she called her assistant, Dr. Ratner, and she saw to it that I got about 10 pills at Providence. So I had to leave home, go down there and pick that up. I got that. But after so long a time, I was down to I'll say about 3 pills. So I went to the post office out there by me in Roseland. I stood in line an hour and a half. Some people had waited almost 2 hours to get mail or medication. So when I got up to the desk, the clerk tells me, well, it's not enough people working, so you need to maybe come back another time. Okay, I was almost out. So then I came home and I called Dr. Ratner. So I couldn't get Dr. Fegan. She was really busy at this time. So they had gave me Dick Durbin's office, but I didn't ever call his office. But Dr. Ratner saw to it that I got the medication. But the thing of it is, I never had a problem out of all those years of mail order. I never had a problem getting my medication. And I talked to my postal worker that next day after I went to the post office, and she said, well, they had medication there, but it wasn't nobody to pass it out. So then I had to wait a couple of more days. So finally I was down to 1 pill, 1 high blood pressure pill, and then it came. But that is really, it's really convenient to have the mail order pharmacy, because it's too hard sometimes going to the drugstores. You go there. I know people that go. It's not finished. You got to go back. But this is much better coming to my house. I don't have to worry about it. So it's a big problem. It's a lot of people that does get medication through the mail, and it's so important because it does save our lives. And I am a senior citizen, a registered voter, been a voter since I was 18, so I know how important it is to vote. And so it's just a wonderful thing, but the post office, I've never seen this kind of problem. And while I was standing in line to see about my medication at the post office, it was some people that were standing there. They had been waiting about 2 hours for it, and they hadn't got their mail for about 2 weeks. So, but it's not enough workers. They cut the workers down at 110th and State. I don't care where I say it because I live out there. And it was only 2 people, 2 clerks. And there was so many of us standing up there, and we were just tired, and I was just tired, but I needed to see if my medication was there, but it wasn't there. So I really had a hard time. So finally, I got my medication. But I hope and pray in the future that I don't have to go through all those changes again, because it's just not good. I am a senior citizen, and I do want to live as long as I can. I'm trying to take this medication like Dr. Fegan. I have a wonderful, wonderful doctor that I really love, and she has a bedside manner that I love. You can call her anytime, and she will respond. If she doesn't, she'll have an assistant to respond. So, and I love her dearly because she's a caring person. And I just thank you for this afternoon, this opportunity, and I'm hoping and pray that I don't have to get up and say this again another time. Thank you.
Thank you very much. All right, Nick?
All right, we'll take questions. First, we'll go with Cranes. Cranes?
Yes, this is Wendell Hudson.
All right.
What are you asking?
What's your question? Do you have any questions?
Oh, I'm sorry. I didn't hear that part. I just heard you say crane. So my question is going back to what Senator Durbin had said when he said 1.2 billion prescriptions are delivered annually by the post office. I'd like to know where you got that figure from.
From the post office. That's the best estimate they could give us, 1.2 billion each year.
And they gave you the 80% of vets also get their prescriptions from mail? You got that from the
Well,
post
I can't
office?
say for certain. My guess is that's going to be from the Veterans Administration. It's the same figure we all use. So I stand by these figures. I believe they're right. I wouldn't have said it otherwise.
Okay. Thank you, Senator.
You're welcome.
All right. Oh, Charlie?
Senator Durbin, what happens if the Senate doesn't take up the bill the House passed? Where do you stand? There's $25 billion on the table, and right now all you have is a promise from the Postmaster General.
The Senate does not return until September the 7th, so we have at least 2 weeks here. And in the meantime, Postmaster General DeJoy testified before the House of Representatives today. I've not heard what he said, but I followed his testimony last week. He promised to undo the damage, as Congressman Rush and others have noted, undo the damage when it came to cutbacks in overtime. I believe the only way to be certain he's going to keep his word is to have the Inspector General in the Post Office Department and the Postal Service, report to us on a regular basis, which we are going to ask him to do so that we can monitor what is exactly happening. I don't want Mrs. Moore to go through this again. Thank goodness you survived it this time, but we don't want to put you through a second time. But going back to my earlier point, the choice of DeJoy for Postmaster General was a political decision inspired by Secretary Mnuchin, picking a man with no background whatsoever in the Postal Service to come in and shake it up. Well, he shook up America. He didn't just shake up the Postal Service. And we see Democrats, Republicans, and Independents speaking up now. I think the pressure's on the administration. What made it worse was when the president stood up and said, I told you shouldn't vote by mail, even though he did himself. And now it's going to be a big old mess because of the Postal Service. He was almost relieved to tell us that, happy to tell us that. That is what also fired people up to have these hearings. We better keep an eye on them. There's a lot at stake. And the mail movement in the next few weeks is going to decide this election.
Charlie, anything else?
I have a couple off topic, but.
We'll take them after.
Yeah.
Take it off topic after. Yes.
Thanks for listening, especially with you and President who's here. What I did hear from the Joy's testimony today was that the changes that he made were not his. However, he is a person. He also denied that he's a political appointee, and that was really hit very hard today during the hearings. My question is, he says that there is enough money. There is enough money for the election. There is enough money for the elections. So if there is enough money for these operations, why do we continue to see these delays? And the reality that this $25 billion is going to go to the post office looks very unlikely. So what is our reality in terms of moving forward for this patient, for all of the other patients who are looking for things? I know there's
Senator, I think I'll ask you to respond.
Senator?
I want my friends from the House to respond about their bill. Listen, Mr. DeJoy is a generous contributor to President Donald Trump. That doesn't qualify him or disqualify him from an appointment in the administration. But he also is a person with no experience in the Postal Service. It is a multi-billion-dollar operation, and all of America depends on it. And to say that he was not responsible for coming up with this overtime, the fact of the matter is it happened on his watch, and as Harry Truman said, the buck stops here. He is the Postmaster General, and he is the one who can decide whether it goes forward or stops. He tells us that he's going to continue paying overtime, which he should. The $25 billion represents not only the immediate needs of the Postal Service, but the need of the Postal Service to get ready to deal with COVID-19. When I talk to the postal unions, and I bet my colleagues had the same experience, there are a lot of people getting sick who work in close quarters in the postal offices. And we have to accommodate that, and we have to create a safe working environment for them. And they've had a tough time. We have retirement pay requirements in the post office that are stricter than almost any federal agency. So yes, I believe they need this investment. They've asked for it, and I think it's essential if the Postal Service is going to get through this pandemic and be reliable for years to come. I'd like to turn it over to one of my House members who dealt with that bill directly.
The first thing I want to amplify what the senator said. I don't think you have to go back to Harry Truman. I spent 16 years as a CEO of a company. I don't think I ever got a call from a customer who said, your company has failed me, and I said, yeah, well, I'm going to blame the intern. This is a test of leadership. This is a test of whether you're an adult. Do you take responsibility for your actions? It doesn't hold water. With respect to the bill, I think there's a couple things to bear in mind. In the CARES Act, which has passed both bodies, there was an expansion in the lending authority to the post office of up to a $10 billion line of credit. They haven't tapped into that yet. So if they feel that they are in a financially difficult way, they have a vehicle we've provided to do that. Now, we provided the $25 billion above that because none of us were under the impression, nor were the Trump-appointed members of the post office, that $10 billion was sufficient, but they do have cover. And as Senator Durbin said before, the Postal Service is a service. It's not meant to be for-profit. If they are meeting all of their delivery standards and they have a hard time getting through, all they have to do is call. We'll be on the plane in 24 hours. We'll open up Congress. We'll get them the funding they need. That is not a problem that paces. The question that paces is whether they will prioritize this delivery. So I think they have everything they need. It's just a matter of whether they're going to prioritize it. Two last things I want to mention. One is that I was laughing with some postal workers, and they were saying, why is it that the Postmaster General is saying that there's a big surge in mail during elections? Think about your own house. How many ballots do you get in the mail, and what proportion of that is of your mail? It's trivial. And the joke we made was this sounds like teeing up for the war on Christmas, because that's really when the post office volume eats up, if that's going to be a problem. But the second thing to point out is that not to lose sight of the fact that the overwhelming majority of the American people care about whether people get their medications. They care about whether our businesses work. They care about whether we're defending democracy. And if you are nervous about whether the majority of the American people are going to express their will in November, that's a threat. Make no mistake, that is why they are doing this. It is not for financial reasons.
I agree with Postmaster General Roy. He's not a political appointee. He's a political hack. And this is a hackneyed attempt to, as I said before, sabotage this election and the unintended consequences of his attempt and the Trump administration attempt to deny Americans their constitutional right to vote. They are, in fact, threatening the very life of so many millions of Americans. And so, again, he's not an appointee. He's an appointee who is really a hack.
Sure.
Do we need a new Postmaster General?
We need a new president. Go ahead.
All right, we have,
We need a new Postmaster General.
We need a new president. The president appoints the Postmaster General. Go ahead.
all right, we have WBEZ. Becky, I believe. Going once, twice. WBBM? Steve?
Can you hear me?
Yes, can hear you now.
Okay, I'm sorry.
No, you're
I was
fine.
on mute.
Hi, yeah, Steve Miller.
We'll take WBEZ first.
Yes.
Okay, thank you. I think my main question is just, what could this is for President Preckwinkle, is there anything that you're able to do locally to sort of mitigate any issues as it relates to the Postal Service, the election, or this issue you're bringing up today about medications? I mean, is there any alternatives you could provide if people are not getting what they need through the Postal Service?
Well, our patients are relying on their mail prescriptions, as you heard from Mrs. Moore. And we rely, of course, on our congressional delegation to raise these issues in Washington and do the best they can to try to address them. So I'm very grateful for the help and support we've gotten from Washington. Our patients here, of course, will need to be in touch with their doctors if they don't get their medications, and we'll do the kind of emergency work that we did to help Mrs. Moore.
All right, Steve?
Yeah, hi. Sorry, I was on Facebook time, not the phone feed. My question is how many people are like Mrs. Moore? How many people are in that position in Cook County?
That is
I think
dependent
you
on,
alluded
dependent on
to
mail
it, but
delivery of their
any
meds, is that what
estimate
you're
as to
saying?
how many people have would not be able to live without their medication that comes through the mail?
Well, I can't speak to that. Why don't we, who can speak to the number of people who get their meds through the mail? Go ahead, come up and introduce yourself again, please, for us.
Good afternoon, everyone. My name is Dr. Casten Norwood, Senior Director of Pharmacy Services for the health system. So we have a large percentage of our Cook County patients who get their maintenance medication through mail order. To attempt to prevent patients being in the situation as Ms. Moore, we stay in constant contact with our patients as they call, and we remail medication or try to remail it at a different outside of the post office if it is urgent and emergent.
Do you have a number, though? I think she was asking for a number. 20.
Yeah, so.
And how many patients is that?
So mailing about 20,000 prescriptions a month, I would say it's about maybe 20–30% of those patients. Thank you.
Thank you.
All
that
right.
it, Nick?
And I believe we have the Tribune on the line.
Yes, hi, this is Lisa. You mentioned that some of the zip codes that you serve have been getting half of the mail order prescriptions have been delayed. Can you give me some examples of some of those zip codes that are experiencing the highest delays?
What zip code are you in, Ms. Moore? 60628. Well, 60628 is one. That's Mrs. Moore's district. Karen?
Hey, Lisa, it's Karen Stancic. 60620 is at 51%. 60632 at 45. 60628 at 51. 60649 at 55%. We can get you more if you need more.
And have you seen any improvement so far yet this month now that they said they're going to hold off on implementing, the post office said it's going to hold off on some implementing more of these changes? Have you seen any improvement in August?
Anyone? I think we continue to get complaints about the service, so. Nick?
Anything else? All right, we have another question from Cranes. Could Dr. Fegan or President Preckwinkle talk about what workaround CCH has had to undertake to get prescriptions to people? Others have used FedEx and sent prescriptions twice.
We looked at FedEx, but the number of prescriptions is so high that it's not affordable at this time. So if a patient has not received their medication, the first thing we do is we provide them with 7 to 10 days worth of medication that they can pick up at the pharmacy, either here at Stroger or Provident, while we try to locate where the medications, if necessary. Then we mail out a second prescription.
Okay. Any more questions on the line before we go to off-topic questions? All right, Charlie. I just wanted to sample the opinion of our elected delegation about what happened last night in Kenosha. Any reaction to the shooting of Mr. Jacob?
I have to tell you that all I know about this is what I heard on the news, so I'm not going to comment.
I watched the video. You can't watch that video and understand why that man was shot the way he was shot. Getting back into his car with no weapon in his hand, he was shot from behind by that policeman multiple times. It just, I can understand the strong feeling so many people have that this is recurring over and over. We thought that May 25th and what happened to George Floyd would be a singular call to across America to stop this wanton killing. But sadly, in Kenosha last night, a video that is there for the world to see left that man wounded and in critical condition. It was a heartbreaking moment again.
I haven't had the benefit, as the senator has, of seeing the video. However, You know, I've always said that I live in a country in which black and brown people can be shot and killed by the police with impunity.